You ever been billed for medical services after being told you were covered?
Actually, yes, I have. Again, working with insurance, I think that happens when you're told by your insurance carrier that a service doesn't require a quote-unquote pre-certification. And so you go and have the service rendered, and then once you have the service rendered, you receive a bill. Well, that's because the insurance carrier either one failed to tell you that a pre-certification was required, or you were given misinformation.
Yes. So I had a catastrophic accident and wound up in a trauma center for a week. My first bill was $82,000, and it had to do with only renting the room where the bed was at. So it didn't actually cover the surgeries I had at the trauma center, the medication, the life vac helicopter, or even I was out in the middle of nowhere, so in order to get me to a bone hospital after I finished with the trauma center, I had to have special transport, and the ambulance ride wasn't covered either. But the medical bills were well over $300,000. And that was just for the trauma center. And then I spent a month and a half in a bone hospital, and those medical bills were so large that they just wrote them off.
I can tell you this. Well, my husband, he had lots of doctor bills, hospital bills, but my insurance, we thought, was like a HMO that covered everything, but it really did not. And we were very surprised to get a large copay bill. And I've been paying for my insurance for the last 38 years.
Should have got a discount.
Yeah.
If you have insurance, them stating what they're going to do is not going to help you on the insurance part. I would recommend, if a person is going to have a service done, they need to call the insurance carrier first to find out if it's a covered service. That way, there's a legal document somewhere.
Make it more affordable. That's just the biggest thing. That's, people get tired of going to these free clinics and they're not getting the help that they need.
Once you get a plan, even if the companies change or something like that, your plans and doctors and the things that's covered should be grandfathered in where you consistently have that plan.
There's certain problems certain people in different communities don't have the money for, as far as like going to the gym or workout or eating organic vegetables or organic food. So I wish they could take into account, okay, this person in this class, we need different stuff to help this person get over something in comparison to somebody that, in the upper class and has more money.
I would definitely say read your policy with the fine-tooth comb, because there are different entities and cases with insurance where you may be covered in one area that you think is really, really great, but then later find out you need coverage in another area. But however, because you didn't read and you didn't select those specific options in your policy, you didn't get that insurance that you need. And many times we get things like a basic health insurance, and we'll leave off like prenatal care, and then boom, you're pregnant and it's too late to get the prenatal coverage. As someone selling insurance or someone who owns an insurance company, I would rather have a patient, or a client rather, who has been healthy for 80 years. Someone who is 80 years old, let's say, or 90 years old, and their entire life they've done preventative work as far as health care goes. They've kept a healthy lifestyle, and they've also been able to use benefits that my company has provided through the insurance company, and tools through the insurance company to keep them healthy for 80 years, having them pay this monthly premium, offering discounts over time because they've done such a good job of staying healthy. Versus, I'd rather have that and turn a profit rather than not give good health coverage and then have people's health deteriorate argue with them forever and ever about what I'm going to cover and what I'm not going to cover, and what they're good enough to have and what they're not good enough to have, and then have them die at a young age because they didn't get the proper health insurance coverage or health support, and then I end up paying $1 million policy to their family. That's a huge loss. And I'm not condoning profit, but I'm saying if that's the route you want to go, maybe that's the way you should play the game.